ProCare Optima Prone is a dynamic pressure redistribution air mattress which is suitable for pressure injury prevention. It helps to prevent pressure injuries in patients at high to very high risk or who need prone position ventilation treatment. Used in both the supine and prone positions, the individual air cell deflation design allows the patient's vulnerable areas, such as the head, heels, abdomen, groin, and dorsal feet, to be maintained at zero pressure and thus lowers the risk of pressure injuries. With ProCare Optima Prone, you can experience the best: better control of individual air cell deflation, excellent relief from pressure on the face, single-handed care, and therapeutic pressure relief zones. Better control of individual air cell deflation allows you to offload vulnerable areas individually. Particularly for the first 3 air cells in the head section, caregivers can deflate air cells to create space for repositioning the patient's head without having to lift the patient's shoulders manually. Excellent relief from pressure on the face, provides gentle support to the patient's head, and nearly zero pressure on the ears when the patient is in the swimmer position. Single-handed care helps save on caregiver resources by utilizing the special configuration and innovative head repositioning function, which enables the repositioning of the patient's head to be done by one person only. Therapeutic pressure relief zones provide for different air pressure levels in the head, torso, and lower leg sections, while ensuring stability and comfort to the patient. The intuitive graphic design on the LCD screen is easy to use, and it can help save time for caregivers across all care settings. After activation with the simple one touch for power, the mattress will begin to inflate, and the auto adjustment process will begin and create the appropriate pressure in accordance with the patient's weight and position. Alternating and continuous low-pressure modes in both the supine and prone positions are available with an easy click. After selecting the prone position mode, more functions become available to assist in carrying out difficult tasks. The pump will start to inflate the mattress to the maximum level to facilitate the repositioning of the patient from the supine to the prone position. It will beep once when it has reached the maximum level to alert caregivers. The pump will revert to the previous setting automatically after 20 minutes. As it enters the prone position mode, the timer will automatically start to alert caregivers of the time the patient has been repositioned in the prone position. This keeps caregivers aware of the time when giving medical care to the patient. In accordance with standard clinical practice, the patient's head should be repositioned every 2 hours when it is in the prone position. The head reposition mode can help caregivers to conduct this task easily and effectively. The patient's shoulders and chest will be lifted upward as the caregiver selects this mode, which simplifies the head repositioning process. The head reposition mode will remain on for 10 minutes and then revert to the previous setting automatically. When in the prone position, the patient's neck can become hyperextended. Therefore, the shoulder lifting mode is designed for lowering the risk of hyperextension by lifting the patient's shoulders and chest upward. 2 different angles can be selected for individual needs: 10 degrees and 20 degrees. With ProCare Optima Prone, everything is simple and reliable. ProCare Optima Prone, simplicity redefined.